Hi everybody, I'm Dr. Qazi. I'm a skin restoration specialist in Newport Beach, California. I focus mostly on acne and scars and pigmentation. I do a lot with facial balancing as well. I'm going to highlight this patient. He's somebody I worked on last year, and then a couple of weeks ago I ended up doing his second phase with more laser. So I'll walk you through what I ended up doing for this patient and basically showcase for a patient who is of Asian descent in his 30s, how we could treat these scars and essentially make sure that your pigmentation remains normal, make sure that we could really help you heal. He actually also, we tightened a bit of his neck area as well with something called face tight as well, which really helped him as well. So I'll walk you through the different steps that we did for this patient. Mostly it involved doing subcision. I broke up that scar tissue really well. And then I was actually thinking about originally doing excisions for him, but I didn't need to do that actually with him. I ended up breaking up that scar tissue so well that first time. And in his case, I did Taylor Liberator subcision to break that up. And then I also did some CO2 laser for him, as well as an erbium laser, TCA Cross, all those combined. And we ended up doing that first session last year. And then we did a little bit more with a few more times of TCA just to help with some of those ice pick scars. Really lifted up really, really nicely. And again, I saw him just a few weeks ago now, and we'll have an updated photo. So at some point, since he did the second step of the treatment, and it's going to be awesome. It'll be really good. So this is a patient, he's in his 30s and otherwise actually healthy, but he was concerned about a couple of different issues. One was that he had these deep scars, some ice pick scars. He had an area that was really bothering him on that lateral cheek. You could see where it was really indented, and it was a pretty deep scar at that point there. So worked on that, lifted it up really nicely for him. His skin tone got better as well because we worked on that as well, partly with the erbium laser does help sometimes for some of that pigmentation, and then the pigmentation cream we placed him on helped him as well. So a lot of different options. Thank you, everybody. Thanks for joining us right now. I appreciate you. I'll kind of repeat for those just joining and asking what we did. We did a few steps. I did one session of a combination session last year. So this is, it says right now 6 months out, but now I just saw him recently, and we did a second step right now. And ended up first breaking up that scar tissue. In his case, I used Taylor Liberator subcision to break that up because it was really thick right there. So that ended up being one of the processes right there to lift up those scars. We did TCA Cross, and then we also did lasers. Oh, Solmacha's on. Thank you so much, Solmacha. Solmacha is 3 weeks post-op. We did the procedure 3 weeks ago, and he's also working as a teacher. So sometimes at nighttime, just for this quarter, he's saying. So he says 10 minutes self-imposed break from teaching. I appreciate you joining me for your break time. Thank you so much. And good seeing you as usual. Good always talking to you in person. You're doing really well. Skin's looking good. Oh, it looks like a few more questions that I missed. Let me try to catch up with everybody. Okay, so I'll kind of recap in a little bit about what I did because I just did that a couple times, but the difference between different forms of subcision. So that's a good question. Basically, we have a lot of times for me in my practice, what I do is mostly blunt cannula subcision. I also could do something which is more sharp, which is a Noker needle. And that's where I go right underneath the scar tissue, really release those bonds right on the surface. It's very, very nice. It's basically a blade form of the needle, and just go right underneath there and break up that scar tissue. And then I also have something called a Taylor Liberator. And that's for really when the scars are what are called more intradermal scars. So I go inside the dermis, and I'm breaking up that scar tissue really meticulously. And I had to do that for this patient. I didn't do it for like everywhere, but that area that you see that's really pulled down and really stuck, I really had to break that up. And so I did that with the Taylor Liberator in this case. Worked out really well. You can see. Hi, Kimmy. Thanks for joining us as well. What's the average cost for Pico laser? It depends on how much pigmentation you have, how long it's going to take us. For melasma, it's different than maybe like post-inflammatory hyperpigmentation. Melasma patients, it could take about 6 months or so to clear up some of that pigmentation. And most patients for melasma spend about $3,000 or so. Do you happen to know how to get rid of a red rash under the eyes? There's different reasons why you may have that. It's tough to say what that would be. And what kind of irritants you place on there. So usually it's first stop any irritants that you're doing, or like any creams that you're using over there. Potentially you could do like a really low dose of hydrocortisone potentially, but it's tough to say unless someone sees you. What's the cost of this particular procedure? It's tough to say exactly what this particular patient paid. Most patients spend about $5,000 to $7,000. We did have to do a few rounds of TCA Cross for this particular patient, which helped out a lot. And then they also did a few steps really with skin tightening, which is a little bit separate, not typically what I do for acne scar patients. But I did do some skin tightening with Face Tight and something called Morpheus 8 along the jawline there as well, so to get a little bit more tissue contraction there. So that's a bit of a different process than what a lot of other people did. I don't believe actually at all. I don't think I just double checked. It doesn't look like we did any Bellafill, which I'm actually surprised by because I thought there would have been a lot more fat loss over there. But breaking up that scar tissue, that's why sometimes you'll hear me in consultation. I'll say that let's take a look first. I'll break up that scar tissue to see how much volume loss there is. Sometimes it's like, really, we definitely need to put some in there. And I think we probably could place a little bit in like those little small pockets there if we need to, if he wants it there. But at this point, I haven't done Bellafill for this patient, which, pretty impressive actually, without much volume loss, just with just actually with subcision, just lifting it up, breaking it up. So I'll tell you what you need. It's like I see it over and over. So I'll tell you, like sometimes I look at it and it's like I did think that maybe after we lifted it up that there would still be some volume loss, but in his case it wasn't the case, and we didn't end up needing it. So TCA Cross really helpful for those ice pick scars, though really useful for that. So you can see, a few different steps. It's possible. That's okay. Did I have to do more than one subcision session for that deep scar? Was that one enough? That was one time. One time we did it. One time with subcision for this patient. And in general, upper part of the face, really, I try to get it so that it's done in one time. I really do. I do it very effectively every time. That's why I don't do too many cases. I try to just limit myself to 3 really combination sessions a day. I want to have enough energy really to make sure I can focus on those areas, focus on those spots, and really properly break it down without doing anything else. My dog just came in here somehow. So Sagarza is concerned about Bellafill causing lumps. So, that's something I would say it's very operator dependent. And the way I do it is small little micro droplets, like tiny little micro droplets. And you do that, and then you wait a little bit, and then you do it again, and you wait a little bit, and do it again, and wait a little bit, and just do that a few times. Daisy Dukes is saying, I wish I found you 10 years ago. Well, I appreciate you, Daisy. I'm here now. I'll help you out with it. I will help you. That's why I talk about this all the time, because I do wish that everybody should know how to do this properly. And that, like, if you're kind of told a certain other way, like, this patient, he was told, let me see how many sessions he had of microneedling. I had it written down for this one. Let me see something here. I think it was microneedling and Fraxel laser. Yeah. So he did Fraxel lasers, which didn't help. He did microneedling, 3 sessions of that. He did multiple chemical peels, didn't help. So it's, look at those scars. There's no way that would have helped out with those scars. There's no way that would have helped out. So much is asking, do you subcise ever when injecting Bellafill just to double check? Yeah, absolutely. Sometimes I would check that, and not necessarily with like the full tumescent type of way that I do, but if there's any little spot that's still stuck a bit there, sometimes I could catch that and I'll still break that up there right then when I do the Bellafill. So yeah, absolutely. I'll double check that at that same time. And sometimes it's like, I like to just double check and triple check, and just like, when I do it, I even, in fact, for you, after I broke it up, I'm like double checking and triple checking and like just like going through it again and again and again, because I just want to make sure, because I'm really like compulsive like that. I just want to make sure it's like really done. And it's like, when you think you're done, you're not done. So just go and double check. So I do that all over and over and over again. Let's see. Gusan is saying, Doctor, does retinol 2% work on acne scars? Well, it'll help a little bit with your oil production. Not going to help really too much where these kind of scars, especially, not going to help much for that. And this patient was on topical retinoids beforehand too. So Garza is saying subcision is definitely the way for this type of scarring. Yeah, absolutely. This is like a classic subcision case. This is a perfect subcision case, actually. And it's, there's almost no other way I would say that we could have achieved this without subcision. So a lot of people say, can we just, not do subcision? You're not going to be able to get to it without that. In this case, I would say. Bao Kimi is saying, sorry, I don't know if I missed it, but how far apart was this? So this is a 6-month mark for this particular patient. And he came in again right now, just like a couple weeks ago, and we did a second step now. So this was after our first session. We did some TCA Cross in between that time. And then now I just saw him in January, had a little bit of downtime, and we ended up doing basically more CO2 laser and then more TCA Cross. Still didn't do any Bellafill, actually. It was, I guess, I think even at that time, it looked like it was, something that we didn't need to do too much of for volume replacement. But there's some people, it's just you really need volume. It's just like, I like to just tell everybody, just like, if it's what you need, it's what you need. So Garza is asking, does anesthesia affect the collagen production? I think it's a good question. I mean, it's such a short-term type of an effect. It does clear out of your system, so I don't really think there's going to be much of that problem really for long-term problems with that. Can you do Bellafill on ice pick and boxcar scars? You could do it on boxcar scars. Ice pick scars would be really tough to get that properly done there. And that's really with any kind of filler. What treatment is recommended to get rid of dark sunspots when creams are not working? The Pico laser works really well. I have the Pico laser. You could also check out a Q switch, but I'm not sure if it's really going to be the best option there for you. Mags is asking, what do you think about subcision with Bellafill filler? So I don't mind the way I do it with subcision. Basically, I do the Bellafill pretty deep, so that way I don't really run into a problem. But I've seen so many doctors. Actually, one doctor was like kind of arguing the case that he only does Bellafill when you do subcision because it just sort of spreads around. But actually, it doesn't spread with saline, so I'm not entirely sure what he's referring to with that. And in fact, he may actually be putting it in a layer that it really shouldn't be. So then you can run into more problems, and it's a bit of a waste of very expensive product. So instead, if we're doing in some select areas that I've marked out, then that's a different process. But usually after we do like a little bit of that time, I do want you to come back after the swelling's down, and then we're going to place it in those spots a little bit better. And that's, Slow Macho was just coming on right now. I told him that we have to wait a little bit more time because he still has some swelling. I just did his a few weeks ago, and I was thinking we could do some Bellafill, but it's still swollen. And so we're going to have to wait a few more weeks. So I want to make sure that we could do it really precisely. It's a product that's could last forever. So we want to make sure that something like that, we want to make sure it's done really precisely. What is TCA Cross? So that's basically an acid it's a high concentration of an acid. Sometimes people do TCA peels for the full face, but you can't go as strong really with the full face as you can with a cross. With basically what we're doing is directly inside the base of the scar, and then we're destroying some of that scar tissue. And sometimes I put in the inside walls of the scar so I can get a little scar contraction as well. So there's a few different ways of doing that, but it works really well for ice pick scars especially. I also do it for boxcar scars, and also actually you could even do it for some rolling scars. People don't really know that, but you actually could do it for some rolling scars. Osmani saying, hello, Dr. Qazi. Thanks for sharing these results with us. This really gets my hopes up. I have some scars similar to the ones on this patient. Really looking forward to my session. Looking forward to you too, Osmani. When did you say you're coming in, by the way? I forgot. TF is saying, how can someone of a darker skin color 4 to 6 get similar results with CO2 laser? Is there a safe setting with the CO2 for darker skin? So it depends on what kind of scars you have. If you're Fitzpatrick 6, for example, can we do laser? Yes, but I may be doing an erbium laser instead of a CO2 laser. And if we were to do a CO2 laser, it's just for some select areas. Really, I don't use high heat, high energy for like the full face. I don't believe in that at all. Most of my patients are Fitzpatrick 4 and above. This particular patient is Fitzpatrick 4. And you could see we didn't cause any hyperpigmentation for this patient. And this is 6 months out, so you could get a really good sense of what to expect, really, if you are good with sun exposure. He's very, very good, follows all instructions. He works indoors too, which helps too. But there's ways of doing it. I did use the fully ablative CO2 laser for some of those thick scars. I did do that. And I did it again when he came in again, because you could still see some of the roughness around those edges there of the scars. And I wanted to get that better. So I ended up doing a bit more of his ablative CO2. I only did that because he did so well with the first session. When you dissolve under eye filler, what kind of side effects can you have? So a good question. I mean, basically what I do with ultrasound dissolving, especially, what I do with dissolving is typically with an ultrasound, especially around the eye area. And what I do is I first diagnose with a pocket where it's at, that pocket of filler. And then a lot of times, especially on the under eye area, I'll go in directly with the cannula in that spot and then dissolve that little bit. Problem though is that a lot of times people have injected it too superficially, or in the eye area because it's a more of a circular muscle. Sometimes they could push filler superficial. And then what ends up happening over years and years, that it could actually stretch out the skin. So you may have some laxity from that, actually, and we may have to do something like a CO2 laser, for example. I have a patient that I think she's coming up right now. I dissolved, she had, I think, 16 or 18 vials of filler in her face over the course of a few years, and it was really puffy, really swollen, and it really stretched out her skin. So we're going to be doing a CO2 laser to really get some contraction then afterwards. Hi, doctor. I heard that scars can get worse after microneedling. Is it true? Some kinds of scars, sometimes boxcar scars and ice pick scars could get a little wider with that. So that could end up happening there. My derm said that anesthesia affects collagen production, so they prefer to try subcision without anesthesia. In my case, it was like that. True pain right there. That sounds really questionable, really unfortunate too. There's no evidence that it will delay. Like, I'm not sure what they're referring to. What's in subcision with the fluid? It's lidocaine, a little bit of epinephrine, which is just a vasoconstrictor, and it's a lot of normal saline. So and bicarb. So I'm not sure what any of those things would really cause collagen. I'm not sure what they're talking about with that. That doesn't even make any sense. How is that going to actually stop your collagen production? Just epinephrine clears out of your system within hours. I'm not sure. It's just kind of ludicrous. And lidocaine will go out after a few hours either. Some of these people, what they say these type of things, I think it's just worth just double checking. It's like, this is just like the fact that they did subcision without anesthesia. Like, why don't, I should do subcision on that person without anesthesia. Let's see how they like it, Actually, in fact, I won't even, you can't even do it. It's just it's so I can't put people in pain. Tell someone to I actually can't fit. I hate, one of the worst parts that I have, I actually like doing everything I do, but just the numbing injections, I hate doing any numbing shots, because sometimes it's just that initial poke, it's just ouch. And it's it numbs up really fast, but I hate doing it. So it's I can't even imagine the kind of ridiculous type of human being that this person is, that they're going to subject somebody to subcision without any numbing. It's just I can't even imagine that. And I doubt they would do that to their own family member. I've done these treatments on my family members, and they've been totally fine with everything. So I doubt they would be doing subcision without anesthesia on their family. And I doubt they'd want that on themselves. So, I don't know what they're referring to with this type of thing. So it's made up nonsense kind of rules that it's going to affect collagen response if you give lidocaine. What are you referring to? That's, and that's going to be a long-term complication. Clearly, it didn't affect collagen production when we did this. Maybe they just are not good at doing subcision. Maybe they just don't know how to do subcision, and that's what affected the fact that there wasn't enough collagen production. I don't know. It sounds like it to me. It sounds like they just didn't do enough of a job with that. Let's see here. Where was I with all these things? I'm so surprised that somebody did subcision without anesthesia, though. That's just outrageous, though. Can you do Bellafill? On rolling scars? Yes, we could. We could definitely do Bellafill on rolling scars, but usually you still want to break up that scar tissue first. So you do some subcision first so that you're in the right pocket, and then you could place that Bellafill afterwards. Balkimi, I have to repeat your question. I can't remember what your question was, actually. Lupe is saying, what would be the average cost for a Pico laser on both underarms? Our prices are online at Dr. Qazi. You could take a look and see how much the Pico laser is. It's probably going to be, a couple $1,000s though for removing pigmentation though. What causes acne scars? Good question. So basically one of the biggest things is that you have genetically predisposition, if you have scars, to creating a lot of activity with essentially attacking your acne. Basically, when you have an acne, sometimes people just have acne. There's not much of an immune response. It just sort of just like goes away out of your system and it's gone. But there's some people when they have a cystic lesion, their body just goes haywire, and that process as it goes haywire and destroys the bacteria in the skin and tries to just like and eat up the cystic lesion, that gets released essentially, and all the macrophages, everything else gets released. All the inflammatory process ends up causing that atrophic scar. But you also can notice that there's sometimes this hypertrophic process that occurs, like for example, for this patient. And a lot of times that's due to a couple of different reasons. One is because what happens is that there's an area where it's pulled down and stuck. And for example, for this patient, it's pulled down and stuck. And then when he's smiling, animating, there's a little bit more tension in other parts of the skin. And then that gets a little bit harder in some areas. In some areas, like a lot of times below the skin, actually in his case, he had laxity underneath in his jaw area. That's why I had to do face tight to tighten his skin. So what ends up happening with these scars is that there's a process where it's pulled down and it can get thick around the edges. And then you're smiling and smiling, smiling. And then what ends up happening is you get loose as well. Your skin can get loose. And then also what happens is that sometimes there's friction that could occur, and that could cause the scars to get a little bit thick as well. How far apart are these photos? These are 6 months apart for these particular photos. So enough time really, we can see that we're starting to get that collagen response. And then when I saw him in on a few weeks ago, it looked even better actually. And then I think he's going to look even better the next step there. After Accure treatments, can tretinoin be started right away? I would still give it about a week after the last Accure session, but yes, you could go ahead and do tretinoin if especially if I said it's okay to do. It depends on if we're considering doing another session, but if you are done with all of those, then yes, we can. Only Trades is saying that they have finished their MD from India and want to be like me. What's the pathway? Well, I appreciate it. Thank you. It's a lot of essentially just paying attention, listen to what I'm saying, and just you could kind of watch how I do it, and then hopefully you could pick up this, and it's not going to be too difficult for you that way. And then on top of it, at some point I can hopefully train you. So that's probably the best way to do it. Oh, hey, Masood Amin, good seeing you on. Thank you so much for coming on, by the way. Cigars are saying, why when I use to pop pimples, it doesn't cause any scars, and when I decide to leave it alone, it causes a boxcar? Like, I don't get it. It depends. A few different things. There could be essentially too much tension on the scar after a while it's healing. It's a little bit more complex to kind of go into this whole like pathophysiology of this. But I'll kind of break it down in really simple terms. It depends on sometimes one problem is that it depends on the location of the pimple. If it's along, like for example, the nasal labial fold, or along areas where there's more tension, you could, especially when you pop it, you could cause that severe scarring sometimes, because when you're smiling, animating, you're stretching out the skin as it's healing, and then that could end up causing the scars, and that could end up being the problem there. But if you did it perhaps in a different part of your face where you popped that pimple, it may not have had as much tension as it healed, and then you ended up not causing that to widen. So that's kind of like the easy form of that, the easy version of that. Daisy Mancino saying, is it possible to do Subcision with Sculptra, Morpheus, and Halo in one session? I'm scared it might be too much and make my scars worse. Should I put time in between these treatments? Good question. And I guess it depends on who's doing it, what depth they're doing the Sculptra. If they do Subcision and they're doing it just like basically after they do the Subcision, there's a bunch of tumescent, that fluid in there, and then they inject a lot of that Sculptra inside that pocket. Maybe okay for certain areas, but like the lower part of the face, you could run into problems where it gets a lot more swollen over time. So wouldn't recommend it for that purpose. Morpheus and Halo, not going to help for a vast majority of scars. It's not really going to help much for scars. There's a lot of people on here who've done Morpheus and Halo, and they'll tell you the same thing. Maybe the Morpheus could help for like example for like something like this patient where there's laxity. You want to tighten the skin, but not so much for the scars. I didn't really do it for scars for this patient. Let's see here. Where was I at? Does gaining weight help reduce acne scars? In a way, yeah. It does help it actually. You basically get that fat, and if your fat goes into your face too, it's going to actually support your scars, lift it up. So yes, it could help with that. Masood, appreciate you. Masood, I'm going to say it out loud. Masood saying best doctor in the world. Thank you so much. I guess I should show you results since you're on. Let's see. I'll pull up your results actually. Since are you okay with that? Can I share your results? I showed it last week actually. Was it last week? I can't remember. Let's see here. And thank you, by the way. Let's see here. Where was that? I'll try to find. Actually, I'll pull up your photo. Actually, I think it was. I have it somewhere here because I just did it a few days ago or so, right? I'll try to find it. I guess I'll have to. I can't. I got mixed up. I'll try to find it tomorrow then. But thank you so much for coming on and telling us that though. I'll have to find your result again. Where was I at though? Oh, does deep CO2 cause orange peel texture? And it's possible. It's usually, make sure that you're using some sort of retinoid. If you're starting to find that, like you could do like a low dose of that, mix it with a moisturizer, and that could end up helping out actually. So try to consider that actually. Just do like a low dose of a retinoid. It also depends on how long, you did the procedure. Sometimes people say that they had that, but it ends up being like, it was just like, a matter of a few weeks or so. And it's like, just like kind of be more patient with it. I'm not sure how long it's been for you, but it could end up being something that just, with like mild treatments, you could end up just just hydrating the skin a lot. You could actually resolve that texture. I think people get really concerned that it's going to be a more permanent process, but it really doesn't have to be. And a lot of times, like doing like a low energy laser, like the Pico laser, for example, could help out as well. So those are all ways that really you should consider improving that. And where was I at though? CP saying this summer I have a few trips planned for the beach, so I assume it's best to wait for fall or winter. No, we do it actually throughout the whole year. It's not really much of a problem. There's a lot of different options to control it. You guys may have seen me. I posted on social media the other day that I was wearing like this visor. I wear that a lot actually. It helps a lot, and it's like I just do it all the time because it's like anytime it's a little bit sunny, it helps me so I don't burn because I burn really, really easily. So that's what I end up doing. So consider that. Osmani's coming April 1st. Look forward to seeing you, Osmani. TF is saying, what if there are no scars, just mostly dark marks, pores, anti-aging? Which laser is best for darker skin in this case? So yeah, a peel could be an option for that, or a Pico laser. All could be options for that. HL is asking, hi, Dr. Qazi, do we need to use a suction device to prevent retethering of scars after subcision, or the filler would do the job? I don't necessarily do filler afterwards. I don't believe really in retethering of scars, especially the way I do the subcision process. Maybe if you're, you go to the doctor, the dermatologist that the other person was saying, who did dry subcision, basically no numbing solution whatsoever, and they broke up all that poor person's, scars with that. That would probably cause scar tissue with doing it that way. So yes, I would say that would probably be something that you have to take a look and to see how to prevent like a hematoma afterwards, and what your best options are for that, because that's a pretty cavalier, reckless way of doing subcision. But I don't use a suction device actually afterwards in my practice. I'm a little bit concerned about a few different things with those type of devices, because sometimes I am worried is it possible that there could end up getting, like, just from the operator error, that you end up causing actually fluid to collect in some of those pockets that you didn't necessarily have to do, because just by draining the fluid afterwards, putting some compression, we're really, really good. We don't really have to worry about really much swelling afterwards. So I haven't used it. I get concerned about operator error. Plus, we do a lot of these sessions in combination of CO2 lasers or erbium lasers, and doing that suction device could actually be problematic for that, causing too much friction there on the skin. What do you think about Accure? I hear it can leave an orange peel texture. I was originally kind of excited about it. I thought that maybe it would be pretty cool for scars, and I was interested in seeing if maybe there's people that were using it for scars. It turned out that most people weren't really using it for scars. The few people I talked to that did use it didn't find that it really helped much for scars. I'm not sure if it really was something I would have, be pushing for acne scars. And I don't really know if they're even selling the device that much, is what I heard. I'm not sure. Maybe I'm off. Maybe I'm wrong about that. But it sounded like they're not even really, doing too much on the market anymore. Sandrana is saying, does Morpheus work if there's loss of fat and rolling scars in the skin in the area you want to target on? I would not recommend it. I would not, because you could actually end up causing more fat loss. And for rolling scars, you really want to make sure that you have volume, you have some support for your scars. The last thing I want to do is melt fat, destroy fat. So I do not recommend that for that. With how many months of anticipation do you need to prepare your skin or prepare for the procedure? Usually takes about 2 to 4 weeks, most patients. Daisy Massino saying, if someone flies in to be treated, on average for treatments like this, how long would they need to stay in town? Really just one day. You don't have to stay around. You just you can go the next day if you want. Some people just leave the same night. It's no big deal. It's up to you, whatever you're comfortable with. I can manage this remotely, so I have no problem. Unless we're talking about something like phenol peel, that's going to be like for 12 days. Other than that, there's no reason. Why is there no 3D printing for skin tissue to restore skin structure? There is actually. I think it's really nascent right now, but there are some people that are doing 3D printing, which I'm interested in because it would be cool to do that for certain grafts, for example. If it's right material, if it's not going to cause reactions on the skin, it could be really interesting. You can see. You could look at all these people right now in Gaza that have like their skin just burned off, and it'll be amazing if we could potentially give to print some of the skin for them. That'd be really amazing for us. But I don't know if we're really there right now. It's just something that I know that they started working on. I forgot what scientist it was. It was pretty recent though, probably about a few weeks ago, where I saw a report that they have actually 3D printed some skin. And it's really, really nascent though. So let's see like where it comes from. But it looks like it's like they're saying that it looks and feels just like real skin too. Obviously, I haven't touched it or played around with it or anything like that. But let's see where it goes from that. Emil is saying, I'm Filipino, no deep acne scars, derm recommended microneedling exosomes and skin boosters for a year. Is that enough? Sure, if you have no acne scars, why not? Did this person have erbium? Yes, we did erbium to blend in the CO2 laser areas. I do CO2 for like the thicker parts, and then I did a lighter blend of erbium laser elsewhere. Would implants be better than repeated filler? Do you mean, well, I guess I should clarify. What do you mean by implants? Like you're talking about like a cheek implant? Like if somebody has like a huge indentation in the cheek, you put a cheek implant? The problem with cheek implants is that a lot of people could run into, I think that it could be done properly, but there's also a bit of a lost art to it. A lot of people kind of moved away from it. They only did fillers. And it'll be tough to kind of see if, somebody, or I should say, it'll be tough to really find somebody with a really high safety profile and doing something like cheek implants. But that'll be like kind of like in the middle, the mid cheek. It's something that you could consider doing, but there's a little bit more risk involved with it. It is a foreign object that you're placing in the cheek area near the sinus cavity. Bit of a risk then for infection then in that area, and potentially even like getting dislodged. It's not like the worst idea. Sunja is saying, thanks for the reply, doc. What about CO2 laser? Will that work better for rolling scars? Can I try a few sessions of CO2 before subcision? I have a combination of box and rolling scars. Do the subcision first. Do that part first, and then do the part afterwards with the CO2 laser, or do it at the same time. Cheek implants for the aesthetic. Yeah, I would have to see like who's doing the cheek implants. Am I opposed to it? No, but like I've seen people's I've seen people's complications with cheek implants, and it's like a big issue. If you have to remove that, it's a big problem, and it's not like something to take light. So that's my concern with cheek implants. I'm not against it. It's just I think it's a bit of a lost art, especially in this country. But that doesn't mean that you can't do it anywhere. There's not like somebody who does like a really high level of it. I just haven't seen it though. But if there is, absolutely, you could consider doing that. I like the questions, but really good questions. I'll stay on for a couple more minutes. I was planning on leaving just right now. But let's see here. Could AI play a role in future scar treatment? As it is right now, I don't know. Basically with these LLMs, I don't know. But as it gets to like more like AGI potentially, and then also like potentially with like what they call ASI. I don't know if you kind of follow all that whole world. Then maybe, but I think the people that are running that whole show, the people that are going into that, I don't know if you'd really trust them to to have their AGI, who's smarter than humans, help us out. Really, let's just put it that way. Do you know someone in Dallas that does TCA Cross? I don't. I know a lot. I have a lot of patients that come from Dallas, a lot of patients that come from Houston, and they tried a lot of different things, but I haven't actually seen anybody that that they said is like that they're wowed by. And there's some places that I would say that are good. Looks like somebody needs attention here, so I am going to. It looks like she needs to go out, so I'm going to go help her out, and I will see you guys again tomorrow. I'll see you guys all, and I'll answer